The latest on the Ebola outbreak. We are learning more about the Texas nurse who tested positive for the virus. Here's what we know now. 50 people who may have had contact with her are now being closely monitored. Federal health officials launched a review of procedures, and the director of the CDC says he would not be surprised if another hospital worker gets sick. CBS 2's Hazel Sanchez reports.
26-year-old Nina Pham, a nurse at Texas Health Presbyterian Hospital, contracted the Ebola virus while caring for Thomas Duncan, the Liberian man who died from the disease on Wednesday. Pham's father says she's in stable condition and in fine spirits, but Pham does not know how she became infected.
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield.
CDC Director Dr. Thomas Frieden suspects Pham may have touched contaminated protective gear. Hospital officials are trying to pinpoint when that lapse may have occurred and how many other people will need to be monitored 21 days for possible exposure. The CDC is reevaluating protocols for using protective gear and limiting the number of healthcare workers who have contact with Ebola patients.
We have to rethink the way we address Ebola infection control, because even a single infection is unacceptable.
Doctors from North Shore LIJ Health System showed us the protective gear a nurse might wear treating an Ebola patient. Experts point out this is especially important for anyone cleaning up bodily fluids or doing a procedure on a patient like dialysis, drawing blood, or breathing tubes, all high-risk procedures for contamination. Taking off the protective gear is the difficult part of infection control protocols. That's when any infectious bodily fluids might be on the gear.
When you remove the suit, if you accidentally touch something on the outside of the suit or the outside of your gloves with your hands or some other part of your skin, then the virus can be on you, and then that's how it can be transmitted.
Mayor Bill de Blasio says Bellevue Hospital is in a high state of readiness in case of any Ebola cases. Bellevue officials say it evaluated 2 patients this morning and quickly determined they did not have the virus.